Dr. Laungani, what is your experience has been with these metastatic prostate cancer patients?
Typically, we see it very commonly in the post-prostatectomy setting. To your point, we'll have the individual who come in with a PSA 100, 200, 500 plus, where we know we're probably going to see bone mets or lymphadenopathy on CT scan or a PSMA scan that lights up. But generally, the patient that we manage very often is the post-prostatectomy patient who we do a radical prostatectomy or robotic prostatectomy, and they have poor prognostic features, T3B staging, Gleason 9 disease. We kind of know that the inevitable is coming, and we discuss with them hormone therapy, ADT therapy, and again, introduction now at this point of saying, well, you can have an injection with me every 3 months, or you can take a pill every day. These are potential side effects. These are long-term side effects that have been documented if you're on it chronically. We talk about things like intermittent therapy. We talk about quality of life, because I think what we have forgotten is the actual impact that medications like Lupron or Orgovyx have on, I'll call them our men. And we inject them and we send them on their way, but I don't think we realize the mental health aspect, the loss of quote unquote their mojo. And these are important things for men who still have 10, 15, 20 years of good living to do. So we have to battle that, but I think an important point is that what used to be just, hormone therapy and then straight to medical oncology for chemo, we now are able to hang on to our patients for a greater number of years, giving them options for so many of the novel therapies that are out there. And I think the patients like continuing the journey with us. I think there's something to be said about that. I think once they hear the word medical oncology, they get immediately worried that, okay, this is the end, or yes, my prognosis has officially changed because I'm going to see the chemotherapy doctor. Yes. So the relationship we have with them, battling incontinence, battling ED, going through surgery, going through radiation, that's a relationship that I think is extremely valuable. And the fact that we can continue that with the newer therapies I think is huge.
Yes, yeah, no, I think you really, brought up some really important, points and aspects that we really need to focus on. Dr. Baer, if you can share your experience, in this space.
Yeah, I'd like to piggyback kind of what the others have said. Kind of first taking one step back, talking about, access to the PSMA PET. I think it is a barrier, but I think it's getting better. Mm-hmm. I can just see now versus 2 years ago, new guy coming in, Gleason score 8, PSA is over 15. We're all thinking, probably got metastatic disease. Back then, insurance would say no. You had to have failed treatment, and now it's almost like we can use that on the front end, yes, which I think means earlier diagnosis, earlier answers discussions with our patients. Also, I think it helps start that process a little bit faster to educate. I think it's key that we educate our patients, and we're the first line. So, if they've got metastatic disease, we're letting them know, all the options, whether we personally treat them versus do we get the medical oncologist on board. I think that's the key, because the treatments out there today are fantastic. And, if we can try to limit some of the side effects with some of the new medications, I think that's great. But I think deep down, picking back with Dr. Laungani, I think most of our patients, they think we're the quarterback, and then, the medical oncologist is a wide receiver. And that relationship of communicating, telling the patient we're going to be there throughout the each and every step, I think that's been a huge plus, at least for my practice, and I know for the other guys, it's very important, because you don't want to give them up, you don't want to lose them, even though you fully trust, what the medical oncologist has to say. But I think that relationship is very important.
Yes, yeah.
Can I chime in? The other thing is the importance of communication. Mm-hmm. As world goes on in our lives as practicing physicians, there's a breakdown in communication. And when you're able to have a team effort, a multidisciplinary approach where everyone's got our cell phones, we're able to just be like, hey, Dr. Parikh, did you see him on Tuesday? Great. You saw him. Great.
Yeah, no, you really, nailed there, because I think communication is key. We have a great EMR systems, but, I tell patients all the time, unfortunately, the two systems don't talk. And that's where the relay of information doesn't happen. So, just having a physician-to-physician communication, is so important, so that way we can make sure that patients are getting this best treatment in an appropriate way.